So first we have David Plummer. He's a wildlife photographer and film consultant, best-selling author, conservationist, teacher, mentor, and inspirational speaker. In 2009, he was diagnosed with Parkinson's disease, and he's been fighting for awareness and a cure since. So he's actually going to start off by telling us like what got him to this project. And his partner in all this is Dr. Tosh Fothergill-Misbah, a research associate working on a National Institute for Health and Care Research Global Health Research Group, transforming Parkinson's care in Africa at Newcastle University. Her background is in biomedical sciences, gerontology, and global health. Her research interests are primarily the lived experience of Parkinson's disease, particularly in Africa. Tosh is interested in translating research into policy and consults for the Brain Health Unit of the World Health Organization. Thank you both for being here today. And as I said, David, I'd love to have you get started with what prompted this film.
Well, it started.
Oh, you've got to unmute. You muted yourself. Perfect.
I worked abroad for 6 months of the year with work, and I also do work at home. But it was my first trip since COVID, and I was in Sri Lanka. And as I was working, I was just getting a terrible response from people, ridiculed by people in hotels, being hotel staff. I was arrested at the airport, so I cut my trip short, came back and decided to do a bit of looking into this sort of stigmatization and persecution. And then in my sort of searching around, I came across Tash, and we sort of decided to do a documentary. That's very long story cut short. There were about 1,000 meetings on Zoom before that. Over to you, Tash.
Yeah, just to say, yeah, it was a bit of a shocking story to hear from David's experience in Sri Lanka. And we were connected by a mutual contact. And like you said, after several meetings of thinking about what on earth we could do, we decided that it might be a good use of our time to make a documentary on the lived experiences of people and how they experience stigma in Kenya, which has been the focus of my work. And coincidentally, David was going on a work trip to Kenya to film in the Masai Mara. So we thought, let's bundle it together and go out to Kenya together, together with Ols, who shot the film. And yeah, that's kind of how it all began.
And of course, your passion is advocacy. And so that's also part of like what people can do to help.
Exactly. So it wasn't just let's make a film and there we go, that's great. It's very much about what can kind of the general population, so the Parkinson's community, but anyone who kind of sees it, do to improve the situation. I think sometimes people can forget what goes on in other parts of the world until you go out like David did and kind of experienced it. But of course, people experience stigma everywhere in the world. What we see in this film is this added layer of complexity and violation of human rights that results from the stigma. And yeah, so our hope is that we can change attitudes globally, but also in Kenya, and hopefully change some policy to provide or improve the rights for people with Parkinson's in places in the world where they do experience that stigma.
Bit more about your story though, getting diagnosed. I know we're going to show the film, but I just, if people want to come off mute and ask questions, we just have this awesome opportunity to speak with you both.
Yeah, so I was diagnosed in 2009. I haven't let it stop me yet, although I am getting worse, but I'm still going. So, I mean, I'm off meds at the moment. I'm just trying to get my apomorphine pump out, which is wedged in my pocket, which you obviously can't see, and I'm trying to give myself a little boost. So talk amongst yourselves for about 30 seconds while I just do this.
We're keeping it real here.
David's recently got this apomorphine pump fitted. And just like an anecdotal story, we were on BBC Breakfast news show at the beginning of September, 1st of September, and we had to be at the studios at 6 a.m. And so David was up at what, 4 a.m. or something like
4
that.
a.m. trying to come up on meds, yeah.
And he said, you better be on standby in case I don't come on, because I might need a hand. So that was us at like 5 a.m. in the morning, trying to make sure that we were both ready for the BBC Breakfast show. Are you ready? Are you turned on?
Well, I've got a boost, so.
Wow.
And I've got a Belgian Malinois puppy next door that's destroying the room right now.
I've given mine a chew and she's busy in the conservatory.
She's been fine all day, but now she's hearing voices. She's showing off.
But David, do you want to chat about your experience with Parkinson's, or
well, it's quite a big ask, really. If you ask specific questions, because I've been diagnosed for nearly 15 years. What would you like to know?
Could I ask, I guess, what's the difference in I know obviously, like I said, stigma happens everywhere and people experience that kind of scrutiny wherever they go. What difference have you felt being in the UK compared to being somewhere like Sri Lanka or Kenya yourself?
Stigma here happens, but it has a line, and people know that they should accept it, but stigma still happens. You go to a country that doesn't understand it due to possibly their belief systems or their religious beliefs, and that line doesn't exist. And so the stigma is malignant.
Despite though, you're still traveling. Can you talk a little bit about that? Because like you said, Parkinson's really hasn't slowed you down.
Well, I traveled until COVID, and then took 2 to 3 years out. And in that time, my symptoms got worse and more noticeable, mainly by side effects. Dyskinesia is very misunderstood, and that's probably one of the most problematic aspects for some people. But in Kenya, people don't get medication to manage it anyway. So they just have what's known as a shaking disease.
Someone asked, was misdiagnosis part of your Parkinson's journey at all? Because you were young, and so sometimes that happens.
It took about 9 months, but I was diagnosed with Parkinson's straight away.
And just to add to that, I know it's a very common thing to happen in most of the world anyway, but it's also very common in Kenya that people don't get diagnosed and often are undiagnosed. So they'll be diagnosed with Parkinson's, and then somebody else will see them and go, what are you talking about? You don't have Parkinson's, and they'll be undiagnosed. So it's very, very common in that part of the world as well, if people ever reach a neurologist in the first place.
Traveling solo can definitely be a challenge. Kelly, are we ready to go?
I've lost sound now.
Oh, well.
Oh, that's better.
Yeah, my microphone sometimes doesn't kick in immediately. So that could just be me. Kelly, are we ready to go with the film? No. Okay.
Do you want me to share it, or is it going to be quickish?
Yeah, we're going to need to share it from the internet because the download file has some encoding that I can't play either.
Oh no. Okay. Well, shall I try and do it on my end? Talk amongst yourselves, perhaps, while I do this.
Go ahead.
We do have a couple of questions. Greg is asking, which of the many Parkinson's symptoms has worsened over the years?
Stiffness, mainly. Tremors remained roughly the same, but stiffness, lack of energy, and the duration of the medication efficacy for me. So I've gone from nearly 4 hours to 2 hours for, say, a Cinemet tablet.
As you know, we do have a healthcare issue in our country with insurance. So somebody asked, how are you finding treatments in the United Kingdom versus obviously here?
We have a national health system.
Mm-hmm. So you're not having any problems with medications and
Not
things
at
like
all.
that. You just have your national. Okay.
Yeah.
Does that work?
That's working.
Okay, so you can see it. The trick will be now whether you can hear it once I start. So please do let me know if you can.
David Plummer. In 2009, I was diagnosed with Parkinson's
I can't hear it.
disease.
Can you?
In
Yeah,
this
okay,
short
great.
documentary, I intend to
I
highlight
can hear
the
it.
plight of Parkinson's sufferers in Kenya. Little did I know making it would leave me shocked, exhausted and withdrawn. It seems like paradise when you first get here, looking at this gorgeous sunrise and on the beach. But I've learned, having Parkinson's disease, this place can be hell sometimes. With this film, I'm hoping to change perception. I've never been one for championing raising awareness historically, because my thoughts are everyone knows what Parkinson's disease is. I just want to find a bloody cure. But where I've worked abroad, I'm fighting not only trying to find a cure, but trying to raise awareness. People don't even know what it is. I set off on my journey to meet sufferers and their families who had previously been identified by Dr. Natasha Fothergill-Misbah, a specialist on Parkinson's research in Kenya. I decided to come off my medication when meeting these sufferers because most of them had no access to medication or health care.
So when he first got sick, we didn't even know what the problem was ourselves.
He had problems in almost every system of the body. He had even developed tremors.
nangu makamba ukala hii sababu ya nini? Sababu ya urefu.
Ndo ugonjwa ule wakati ambao nilikuwa sijui ugonjwa huu ni ugonjwa gani.
And with the community around, well, the first thing they thought was that you're giving him a lot of stresses. The stress has brought this disease.
Gabu nangu pia nakuja mbirizwa mimi mchungaji mimi na kamba kuja kanisani kila siku. Hayo ndo napata manufaa. Lakini uko na pia sio manufaa kugusi.
Mwanzo kabisa ili tulikuwa tunapata dawa lakini hayafanyi kazi. Nilifikia kwamba hii ni nguvu za mapepo.
Kulingana na experience ile nimekuwa nayo kwa kazi ya Mungu, una wakati mwingine hivyo spirit waziko
hao nao wanafanya kuwatia tu kujaribu, lakini they are not sure for what they are treated.
I took him to a doctor. He is the first person who diagnosed that there was something called Parkinson.
Even after being diagnosed and even taking the medication, Mom still felt like, no, we can just pray and this thing can end.
On my family, it really affected us. In fact, it really brought us down to almost zero because the drugs were very expensive and not easy to find.
For me, it has been a burden. I've been having a burden in my heart, a very big burden. Sometimes I do get emotional, but I don't want him to see it. Like sometimes I can feel like I want to cry, but I just walk away. Because missing my dad has been my superhero.
You stay with a patient like that for a long time. He becomes part of you in life. And when he leaves you, there's a lot of great loneliness you'll suffer.
If he would just rest. Sometimes you think that, like, God, if you just can't help Dad, if the medication just can't help, then just let him rest.
I was introduced to a private healthcare doctor who only confirmed these stories.
In a private, you can see like 100 patients, like on average. In a public, you can see 2,000. So you might miss some diagnoses and some patients presenting with obvious symptoms. If you're not diagnosed correctly, you'll just be hopping around diagnosis, taking this medication for the wrong diagnosis. So many people, they'll give up on the medication. Can they afford the medication? Can they afford to go and see the neurologist or the neurosurgeon? There is so many misbelief or trust in medicinal or herbal treatment, and also some way into witchcraft.
Anyone living with Parkinson's disease anywhere in the world knows what stigmatization is. Stigmatization is bad enough, but it can lead to persecution. And sometimes this persecution can take on extreme forms.
Most people don't know about Parkinson's. Most people don't know. Here, I mean, in the villages, they are not aware about the Parkinson's. They just still think it is something associated with evil spirits.
Initially, I thought maybe it's some witchcraft, because since it does not have a cure.
Some says it's a curse from their ancestor. If they see him, they say, that is a witchcraft. They run away.
People see it as a bad omen or something like that. They associate it with some evil, some spirits which are not there.
Since Dad is a pastor, he had a lot of pastor friends coming over. They would come, pray. When they were praying and then he starts shaking, they would see that those were the manifestation of demons. And they would just insist on casting those demons out of him.
Walifikiria ya kwamba mimi nimeleta nguvu za mapepo. Kaona ni nguvu za mapepo, lakini haikuwa nguvu za mapepo. Ilikuwa ni ugonjwa wa Parkinson.
Even personally, I have an auntie who was telling me, you know what, that shaking, we can be treated. It can be treated by local medicines and all that.
They cut you in small bits in the skin. So, and then they put herbs in those areas that are being incised. If let's say you have tremors, they'll cut on the arm. They'll do several cuts and then put some medicine or herbals in those cuts.
Hawakuji tena. They just avoid him. They can transmit the disease to their body through shaking hands, maybe come into contact, maybe sitting close to him. So we are not seeing them again.
Then they were like blaming him. What have you done? Where have you put yourself? Are you in some cult or something?
You see, most of the elderly people, they are based in the rural areas. And most of them, they live alone. So if you see an old man or an old woman living alone with nothing, maybe the way she is, she's unkempt, nobody's looking after her. So the next thing, she will be branded a witch. They have gone to the extent of just killing the people.
There's a lot of old men that are being, because they suspected him that are witchcraft. The youth, they organize a group, and then they go to the old man. They say he's a witchcraft, and then they kill him.
The young people come and kill you if they are sure you are doing witchcraft.
There are 3 old men. Just last month, they were killed because of that.
They see anything happening that they don't understand how it is happening and how it is started and how it is going. They come to a conclusion that one is bewitched. It is devilish powers that is working or has been thrown to him.
It's very bad because them is struggling for his life, and yes, someone is coming here to shortcut his life. That's no good.
I found myself withdrawing, hiding away after several days of malignant scrutiny. And the shocking trauma of what I was hearing began to take its toll on me. After such a roller coaster of medication and emotion, I hit a wall.
So I'm totally off meds now because, I don't know, I think we've been pushing hard pace to get this film. This is what it's like being off. Fucking hell. So I don't want to be sympathetic or self-indulgent. I just can't imagine how they live. They just rely on families or the goodwill of someone close to them, with the threat of possibly people coming to kill them for being witches. And imagine that fear. They're just trying to exist, trying to stay alive. They don't even know what they've got. They've not even been told. Truly, shame on anyone who stigmatizes and, let alone, persecutes them. A major change of belief needs to be addressed. The rule of law needs to be enforced. Public awareness of all disabilities needs to be raised. And for heads of state to take this on board and end this brutality.
Lakini chakula ni ile ya tabu tabu, na vile siendi kazi,
inanibidi maisha yangu niko hapo sasa, narudi chini.
ningepata chakula, ningesaidika na dawa.
First and foremost, people have got to get educated.
It's just a matter of awareness, education, information, and it can be managed.
I think it's beneficial to the patient to know that they're not alone, and you can reach out to someone suffering from the same ailment as you, and it's not something foreign, it's not something unknown, right? There are support groups where people find more comfort sharing, and they get comfortable with their condition. They know and they understand what's going on with their system and their body. I think it's crucial to the long plan of the treatment and management of a patient.
It's a cliche, I think, that this week has certainly been a roller coaster. But I do think we have scratched beneath the surface of things that people aren't talking about. There's a distinct lack of medication here, or access to medication. And I think there's a distinct lack of awareness or total absence of knowledge of what this disease is. It's not witchcraft, it's not superstition, it's not cursed, it's just a disease. And these people have the basic right to be treated like normal human beings.
There are glimmers of hope as volunteer support groups begin to emerge in Kenya. Yet these support groups need support themselves, which must come from the government. Kenya, like any other country, is generally made up of good people. But evil happens when good people do nothing.
Really powerful. I don't know for some of you, I've watched this before, so I don't know for some of you if you want to come off mute and just share some thoughts. For some of you, this was maybe the first time you've seen it. For others, you've seen it before. If anybody wants to come off and share some, thoughts. Greg Richer had actually said that he been prayed over by different faith healers who told him that it was his lack of faith that was causing Parkinson's. So it's probably hit a little close to home.
I'm so sorry that that happened to you, and it's just so sad because it puts the blame on you, which is just so far from reality. So yeah, so sorry.
Well, I've been in Africa and I've seen how people live and what they have to go through, and the lack of knowledge in medicine that's available. I'm not surprised by what I saw, but what I see is that you don't know what Parkinson's is until it affects somebody you know, or it happens to you. And this is a problem worldwide.
Yeah, absolutely.
I would say though that in our let's say higher economy countries, we're not looking at our local community and even our families at the end of this sort of flow chart of treatment or lack of treatment. We're not seeing our families turning on us and it ending up with a mob murdering us.
Jen, I saw you had a hand up. Do you want to share something, Jen? You had a hand up.
Yes, I want to thank David very much. That was very moving. And I think the world needs to know this. But I would say closer to home, I work with PANC, which is the Northern California Parkinson's Association. And we've been trying to get through to the Hispanic community. And there is a real issue within our own Hispanic communities here in California, and that they have a lot of stigma attached to their family members having Parkinson's and often won't seek treatment. So I think this is something everyone needs to hear, and also be aware, okay, they don't kill their family members, which was awful, just terrible, but they do tend to hide them away and not get treatment. So it's something everyone needs to be aware of, including those of us living in America.
Absolutely. And like we said, there's different levels of stigma, and it's just an issue across the world, and awareness is definitely something that needs to improve globally. We're at different levels of that kind of awareness ladder, I suppose, within different communities and across the world. So yeah. You know, I've had people and doctors in Kenya tell me that Parkinson's doesn't exist in Kenya. Because they just haven't ever seen anyone, but also haven't learnt about it, which is just absolutely not true. We know that Parkinson's is everywhere. This is kind of evidence of those beliefs that trickle down into the community as well. I noticed someone put in the chat that support groups and self-advocacy are the answer, and I absolutely agree. Read the support groups, and Clemmy and I have been working together this past year, which has been wonderful, and I'm really grateful to PMD Alliance for their support group guide that we've managed to transform into a global edition, which is available, and yeah, very, very useful tool for people to set up their own support groups in parts of the world where they don't already exist. So yeah, very, very, very grateful to PMD Alliance for that as well.
Eden, don't you think that when they talk about numbers of people with Parkinson's, I think in the United States it's highly underreported, especially in the Hispanic community, as Jen mentioned. I think it's also probably massively underreported in the African American community. And when you consider the world in Africa, I personally think it's a joke that people think there's only 6 million people in the world with Parkinson's. I think that number is probably 3 times that size. But one of the things that kind of gets me is even in our country, which I think we're blessed to live in the United States, but to look at the disparity in the research dollars that are put forward between even the neurological disorders, Alzheimer's has had something like $107 billion, excuse me, given to it since the year 2000. And Michael J. Fox associations that I can tell is the greatest research. And they claim they've given $2.5 billion since 2000. That strikes me as a significant 107 billion compared to 2.5 billion. I don't know why people don't take a more active approach in approaching their senators and representatives and saying, we want money, because we could literally end this disease if we did it right.
I totally agree. Right now there's a national end Parkinson's bill in both the Senate and House committees, and unfortunately the Republicans have not allowed them to come out for a vote, and that's tragic. It's 2 years in a row that we've been advocating with our senators and congresspersons, and we just can't get the bills to even come out for a vote on the floors. And you're right, we all need to put more pressure on the legislators.
Well, it's one of those things that even that bill, Joanne, I think I'm glad to see that it's there, but really it's talking about setting up a committee to appropriate the appropriate funds to start giving some money to Parkinson's research, when our government agencies like the Food and Drug Administration or the FDA, they could outlaw paraquat or TCE or any of those other known carcinogens tomorrow.
Katie, I saw you were raising your hand.
Hey, I definitely agree with everything that you all are saying. I think you're making some really interesting points. And as I was watching this video, I was thinking about a friend of mine whose child is graduating with a degree in psychology. And what he is going to be specializing in, his focus is going to be religious-based trauma. And it's interesting because this is a very devout family. So the purpose of this is not to discount anyone's religion or to minimize that, but I believe a lot of what he's going to be focusing on is looking at issues like this when there are other reasons for a situation, but then it's blamed on witchcraft or sorcery or something of that nature because there just isn't the knowledge surrounding the situation. And unfortunately, I think we've seen this a lot in history. I'm very sorry, that people are continuing to experience that, but I am encouraged that at least there are some people in my neck of the woods that are looking into that, and that would be in coastal Georgia, Savannah, Georgia. So
that's really, really interesting. And David and I were talking about this before we went out, weren't we, David, about that dual role of the church and religion and giving you that hope and that community, but then the flip side of that is actually that blame and that kind of totally different side to that community in religion and faith, where people are being accused of doing something wrong or not having enough faith, or putting their faith in demons or devils instead, and it's quite damaging accusations, especially for somebody who was a pastor, like we saw in the film as well, and who's dedicated their lives to that. So Very interesting, Katie.
Ironically, I think we found, I suspected the church was going to be quite a negative effect in Kenya, but the church at least provided a support group, a buffer, a community that was more tolerant than the rest of the, well, perhaps the other parts of the community. I shouldn't say the rest of the community. I mean, UK is quite a secular country, and I'm quite shocked to hear actually that people in the US are being stigmatized by the church. And I think whenever a religious group is allowed to export their beliefs, it's a very dangerous thing. I think anyone's entitled to their own beliefs, but if they try and export it onto other people, it's dangerous.
I think, sorry, go ahead.
Okay, I agree. I was here at a meeting with two of my fellow support group members, and it dawned on me as we were discussing that Parkinson's is an education issue. And I asked, and I said, do we need to talk to the graduating classes at colleges, the doctors, to explain to them what Parkinson's is and what a patient feels when they get a diagnosis? And currently, all they do is give you a prescription and tell you, see you in 6 months. You're on your own. This is inadequate. We're talking about Kenya, but what we do here is just as bad. We just are more civilized about it.
You know, I speak to graduating seniors or whatever, they're getting their doctorate at the University of Colorado. And I live part of the year in Colorado and part of the year in Florida. And it's amazing how smart those people are. But just like Albert Einstein is quoted as saying, there's no such thing as intelligence, just varying degrees of ignorance. And it's amazing when I go in and talk to that group, how little those people actually know about Parkinson's. Now, I'm highly focused on Parkinson's because I'm a person with Parkinson's and I've had it for 13 years. And the symptoms, in fact, progress and do get worse. I just recently had deep brain stimulation surgery, which has helped. And I think will add a few years to my life. But I think one of the real keys is all of us need to figure out what local school or community we could contact and talk to. We've got to just educate people about Parkinson's. They've got to know how many people it affects. Parkinson's Foundation says it costs the US government $52 billion a year. I think that's way underreported as well, but if it is, I know how to save $52 billion a year in the budget. Just get rid of Parkinson's.
It's interesting how a lot of educational interventions and things are focused on the kind of medical students and graduates and doctors, but maybe something like educating the religious communities as well might be a step in the right direction. I know that I definitely know that that's the case in Kenya as well, is educating traditional healers as well, faith healers, religious healers, you know, those community health workers who are really embedded in those rural areas. Because they can't see a neurologist, they don't kind of exist there. So it's that first line of kind of community that we need to target first. Maybe it's the same in rural US or with marginalized groups in the US as well.
Well,
am I
along
right?
those lines, if I could, along those lines, down in Florida, we have put together 2 years ago, we got 2 cities to do it, a proclamation making April Parkinson's Awareness Month. And this past year, we had 19 cities do it. And we're hoping to do something like 30 or 40 cities. But we need to, just like every other group that has MAD or HIV that has dealt with a terrible disease, we need to do a better job of making people, you know, I have threatened to buy a billboard and say, you know, got Parkinson's, you know, and come see this support group, or, you know, here's a website you can get more information on. I think it is up to the Parkinson's community to help the Parkinson's community.
I do also want people to make sure they're looking at the chat. Myra put that there is a virtual, Michael J. Fox Foundation has virtual National Day of Action on October 25th. And Katie also put in the link to her friend's podcast on deconstruction and religious trauma, which I think is going to be fascinating. And then Tash put a paper on stigma and Parkinson's. So I do encourage everyone to save their chat. If you click on your chat, the 3 little dots on the bottom, I will send these links out as well when I send the roundtable roundup, if you will. But I just want to make sure everybody has them.
So am I right in that everyone here kind of is a part of a support group or is involved? Yeah, great. Oh, wonderful. So I set up a support group in Mombasa in Kenya, which is just near where we did our filming. And it's just, yeah, it's amazing how much people get from it. Like previously being kind of isolated and had no one to talk to, and they've just learned so much from it and get such good support. So yeah, it's just incredible the work that support groups can do.
I wanted to say something. Well, Tash and David, thank you so much. That was very deep, you know, moving, and it's very sad. I feel like I was watching some movie just recently where there was an albino child, and there was so much. It's like someone tried to kill him because they had fear, and that's really sad because they don't understand, they don't have the knowledge. But one of the things is with Michael J. Fox is we recently had a speaker that she goes anywhere on the West Coast. So she came just last week and spoke to the Monterey Peninsula, and she was very knowledgeable. Another thing is to try to reach out to your city council people. So I've kind of partnered with one of the city council members. I don't know politics, but, you know, trying to work with them and get them on board so we could get this bill passed.
Have any of you gone to like senior lunches to talk? Because I've been thinking that this is a way to approach and allow people to come to see and be part of a meeting if they know somebody. What I'm seeing is that we have 3 or 4 small support groups in a very large city, and the disease is underrepresented. It's underrepresented with the Middle Eastern, the Asian, the Indian, and the Hispanic communities, as well as the English-speaking community. This is just hard for me to comprehend how we get here. And I guess up to the point that my wife got it, I was part of the problem. I didn't know this existed.
David, were you going to say something?
Yes, I was. I was going to try and raise it a little bit. Yes, I'm seeing comments that it's up to the Parkinson's community to help the Parkinson's community. And I totally agree with that. But we've also got leaders of our countries. You've got senators, you've got a president, we've got members of parliament. We've all got the United Nations. And there are so many member countries to the UN. We have to raise this issue politically. Yes, we have to deal with it on the local level and set up support groups and help each other. But I think we've got to do an organized thing, and both individually and in an organized way. Call out your leaders and just say, what the hell is going on? Why is this being ignored? And this isn't just Parkinson's disease. Neurological conditions are a ticking bomb that is going to destroy economies. We have a national health system in the UK. I think it's very different in the US, and it's going to start costing people insurance when everyone, because we have an aging community. So it's a ticking bomb unless it's solved.
I would just add to that. I was lucky enough to go to the World Parkinson Congress this July in Barcelona, which is an amazing event. It's held every 3 years. It got delayed because of COVID. But there you have representatives from all over the world come and talk, come and listen to all the different talks that go on that were at several different levels, depending on whether you're medical or a person with Parkinson's. Wouldn't it be great if each country could also take a senator along or someone who's really representative of the government in that country, so they could just listen and hear what goes on at those events? I mean, that's the problem. They don't know, they don't understand. And if they would attend events like that, I think it would make a huge difference.
Yeah, the WPC is a wonderful place to connect and to share, and it has historically been a little bit underrepresented in terms of the rest of the world, as it were. But I think it's improving every time, and this time for sure. And I know we supported a few of our African colleagues to attend as well, which was great. So definitely moving in the right direction in terms of representation. But I think your idea is great, and obviously you know, countries have a myriad of problems and issues and things to address, but if we shout loud enough and persist, they'll listen, hopefully. And yeah,
and they did have a good piece at lunchtime where they were talking about communicating in particular with women, but they talked about African women and you know, and really women with color, because they are so underrepresented. I mean, I know it's predominantly males who get it, 65% of men, and the rest women, but like women in particular get a really rough time with this, with diagnosis and treatment.
do you think that you guys could like screen the film at your support group meetings or share it? You know, I'll put the link to the website in the chat as well, but just get the word out would be amazing as well for you guys. Email it to your senators, and I don't know how the political structures work in the US, but whoever is relevant in your states or whatever it is, and anybody who's into any global health aspects as well.
Thank you so much for this, Phil. It really was very well done. I put out a newsletter to a few hundred people or so in my area, and I will definitely put the link in for people to be able to see it. And talking about representatives and things, about it might be worth us thinking about having people come into our meetings, even locally, so they really get to see it more. Being in New Jersey, I already have a senator who knows it well, but you know, we've just got to bring it up.
I think World Parkinson's Day is a good opportunity to do that, but it comes and goes quite quickly every year. So start planning.
Right.
If you have any ideas or any actions to take. Yeah, but do share it. So Larry's received the link, and he's shared it through the PD Avengers network, I think, quite a few times. So thank you, David. Yeah, Larry's a big advocate for the film. But do share it widely. Thank you.
How will we be getting it?
Pardon?
How will we be sent it through PMD Alliance?
So there's a link in the chat, but I'm sure Eden's gonna share around all the
Okay,
links
thanks.
as well.
Yeah, I haven't figured out how to take it off the chat.
Would somebody like PBS be willing to broadcast that film? Their public service network, I don't know, I'm just throwing it out.
Yeah, I mean, any ideas and any contacts with news outlets like that would be very welcome.
I will, sorry, I didn't mean to interrupt. I will actually promote and discuss it with a few people because I do have contacts at PBS and NPR.
Ooh, great.
Wonderful. The power of groups like this is amazing.
Absolutely. And just so you know, I did recently have a fundraiser for PMD Alliance, and I did invite assemblymen, congressmen to the fundraiser. None of them showed up, none of them responded.
It's outrageous, and our leaders have a responsibility to us. They are elected by us and they have a responsibility to us. And I think we must hold them to account.
Definitely. So yeah, so there's a few ways you can watch the film. So there's the website, and David's also got it on his YouTube channel and on his website as well. If you use the shakinghandsfilm.com website, there's also a GoFundMe. So all the people that we saw in the movie were not taking any medications because they couldn't afford them. So one way that we feel like we can give back to that community is to facilitate the purchase of medications for them. And so if you do want to share that link as well, the GoFundMe is attached to that, and yeah, anything is welcome, and it will go straight to buying medications for them, and also for supporting the support group who they support, who supports them. So yes, thank you. Thank you, Kelly. Fabulous. So yeah, any other questions for David about, you know, his experience doing it, or us, or I don't know, are we finishing at 6? Not 6, whatever time it is for you guys. It's 6 p.m. here.
30 minutes. We still have 30 minutes.
Great.
Yes.
So yeah, ask away.
Did you or David start any support groups while you were working on this film project?
So I started the group in 2018. So that was when I was doing my research in Kenya. So that group is the one that we kind of worked with at this point, but we haven't started any more, but we will be starting. So I'm a researcher, so my research focuses on Kenya, and the specific area where we did this filming, we'll be setting up a support group there next year. Well, yeah, the end of this year, beginning of next year. Because it's also a site of what we're doing is a prevalence study. So we're actually doing a community-based door-to-door prevalence study where we go and ask every household in the community some screening questions to identify who has Parkinson's. And from that, we can generate a specific burden or prevalence of Parkinson's in the community and extrapolate it to the country as well. So we were talking about not really understanding the burden or prevalence of Parkinson's in the world. So this is a way that it gives us a kind of better idea of what prevalence is in different parts of the world. So we're doing that coupled with setting up a support group. So anyone we do identify will be able to join a support group and get that help as well. So there's lots of little bits going on in Africa as well on this.
I'm curious.
With all of the stigma attached, do you anticipate a big acceptance to coming to the support groups, or do you anticipate reluctance?
I think it's a bit of both, and I think support groups aren't for everyone anyway, whether you have your stigma or not. And I think from my experience of my research, people are very, very, very grateful to have a community where they feel accepted and where they can get further information, because the health system just isn't designed to give them that education and that information. then they can take that knowledge and go back to their communities and say, no, this is a disease, this is what it is, this is what causes it, etc. Because if they don't have that education, they can't fight for what they know. You know, if someone says, no, you're cursed, they think, well, I don't know what else it is, so maybe it is. Or so when they have that information, they can kind of tell their community what it is rather than just also being totally unaware. So yeah, sorry, a long-winded answer to that question, but I think it is beneficial.
I'm curious regarding the causes of Parkinson's, like I mean, much of ours is chemically related and things that have environmental. What kinds of things are affecting people over it? Is it mainly, you know, through heredity or?
Probably similar causes as in the high income world. You know, only what 20% of Parkinson's is hereditary genetic, so the rest of it is environmental, industrial exposures, etc. But what we'll also be doing is collecting a load of soil and water samples from the houses and communities that we visit and the land that we go to. So we're actually going to be sampling for pesticides and heavy metals in the communities as well.
So they're using the same pesticides and things we're using?
Oh gosh, yeah. So we actually did some analysis of some soil from farms in Tanzania a few years ago, and it was just a whole range of pesticides that have been banned in lots of places of the world that they're still using there. And when they spray pesticides on crops, they don't wear any protective equipment, no gloves, no masks, nothing. And then they use the containers to collect water to drink from. So, so it's this kind of real complex situation with regulation around pesticides. So yeah, that's one kind of avenue of exploring regarding risk factors, which we'll be doing. So hopefully understand it better. And I just add that we're doing this in 7 different countries in Africa. So it's a really exciting project. Sorry, David, I've kind of taken over with the exciting research that we're doing.
It's fine.
But it is very exciting. So yeah, we'll know more in a few years' time, hopefully.
Kenya is a very agricultural country. I mean, we get a lot of our floristry flowers flown fresh from Kenya. So not only are huge pesticides being used, huge amounts of pesticides and herbicides actually being used in that industry, but the carbon footprint of a bunch of flowers is colossal. So yeah, send cards, don't send flowers.
And your green beans and your coffee as well is a huge export. So yeah, pesticides is definitely an issue. I'm also looking at the microbiome. So if anyone's interested in microbiome of your gut, there's lots of interest around that at the moment as well. So people who've had kind of inflammation in the gut previously in childhood, in adolescence, in earlier life are generally more susceptible to developing Parkinson's, and there's a weird link there. So we're going to be exploring that as well. And also sequencing the genomes of people with Parkinson's to find lots of fun, exciting new mutations as well, potentially. So
are families affected by
it? We'll find out. So there are some hereditary forms of Parkinson's, yeah, where you can see the lineage. But yeah, so it's very similar kind of risk factors and things across the world.
Well, isn't the problem compounded in Africa because there's no chemical regulation, so everything happens? And in reality, from what I've seen, there's 2 parts of Africa. You've got the population center and the bush. So even though you think that Africa is developing, when you go out in the bush, they still sell their kids for goats.
Gosh, that's a very sweeping statement, but yes, it's definitely different parts of the continent, and the urban cities are very much industrialized now, and then the rural areas are very remote still. And you know, in like big cities in Nigeria, for example, you have these kind of chemical dumps as well, and like heavy you know, refrigerators and microwaves and these things are kind of dumped, and we no idea what that's having leaching into the soils and drinking water and stuff. So we're just causing so much damage to the planet, aren't we?
I also don't think that heavy chemical use is is still just restricted to lower income nations. I think there's such a huge agricultural political lobby. The Conservative government in this country has just agreed to the use of neonicotinoids again, which cause huge amount of problems. And doesn't Monsanto in the US have a political effect, I believe, especially with the Republican Party?
Mm. Yeah. Are there many movement specialists over there?
On the continent, there's some, not many. There's I think it's 0.03 neurologists per 100,000 population compared to like the US, which has like 20 per 100,000. So big gap.
You mentioned you're doing, you're looking at gut research. Have you, are you familiar with BioQuest?
No.
It's a probiotic company. I cannot think, I would have to research it. I can't think of, this is the product, if you can see it. Her husband has Parkinson, and she developed this probiotic formula, and she does a lot of gut biome research. So she might be someone you might want to connect with.
Oh, wonderful. Thank you. Yeah, I'll leave my my email address as well with Eden, and I'm happy for that to be shared as well if anyone wants to reach out. Yeah, someone else in the chat mentioned Mucuna, and Mucuna is a real promising avenue for not alternative, it is levodopa. So we're doing a trial of that as well, but it just grows in the tropics of the world. It grows in farms, and it's a real promising source of affordable treatment.
I use Mucuna as my second dose during the day, but this is actually a prebiotic. It's not Mucuna.
Yeah. So yeah, it's just like the dual thing. So there's Mucuna, and then there's the prebiotics as well.
Right.
Sorry, I know we've totally diverted topic here, but it's interesting nonetheless, I hope.
It's all related.
The group who likes to talk about multiple things, so no worries, you're in good company.
Wonderful.
What other questions do people have? Would anyone like to share their advocacy? For example, Melissa had said that she used to go to the high schools and speak in the science classes, and I could just picture her doing that. I'm sorry, Barb, I don't know why I'm calling you Melissa, but that she would speak to the science classes to kind of educate the upcoming leaders, as she put it. What are some things people are doing to kind of promote, bring awareness? I know in another group, one of the gentlemen, he's young onset, he has shirts and they say Parkinson's looks like me. And it's such a simple thing, but it just kind of reminds people that, yep, Parkinson's can look like anyone. It's not the older white-haired group or whatnot. He's got tattoos and he is young, and Parkinson's looks like him too. So what are some things people are doing? Because at the end of the day, as Tosh put it, this is about advocacy. This wasn't just like, let's make a nice film. This was about bringing awareness. Yes, Joanne.
Back in mid-December, my husband and I moved to a continuing care retirement community. And we made that decision because 4 years ago, he was diagnosed with Parkinson's. And we decided that we wanted to be in as much control of our lives and our care as we could. And both being educated in healthcare field, we knew what we have approaching us in our future. So we moved and we did a lot of research, and we came to this community. And once we got here, we discovered that while there were various exercise programs, there were no specific Parkinson's programs. and there were no support groups. And no one was talking about Parkinson's, but when you would sit in the dining room and just kind of look around at the general resident population, you could see it. They're there. And so I went to the administration and I challenged them and said, you have to do something. And I started talking about the numbers of people in the US with Parkinson's who are diagnosed every day. And the fact that if they're a continuing care retirement community, they need to be addressing Parkinson's instead of it being the elephant in the room. And so we formed a task force of those with Parkinson's and their care partners, and we met with clinical administration. And we now have a person who's off being trained for rock steady boxing.
Great.
We got the exercise PT folks to put an actual brochure together outlining the various exercise programs that are appropriate for Parkinson's. And we, October 19th, we start our first support groups for both PWPs as well as care partners. And on December 6th, I've pulled together the Debbie Brooks, the executive
Michael J. Fox.
Director for Michael J. Fox Foundation, as well as the chief of the Parkinson's disease program here in Delaware, and our state congresswoman who has been a co-sponsor of the National Parkinson's Bill. They're all coming to talk on December 6th. And my biggest fear in doing all of this is that we're going to have this December 6th program roll out in a community of about 500 residents, and nobody's going to show up because of the stigma attached to.
Oh no.
That's my big fear. So, but that's what I'm doing since I've been here since mid-December.
Where are you in Delaware?
I'm in Wilmington, Delaware.
Oh, you're in Wilmington, because further south, they've got a big program going.
We actually moved from Sussex County to Wilmington because the healthcare is better here in Wilmington.
In Wilmington, okay. Yeah, I know. Yeah, the one doctor there now is another one and is gaining another and has some special.
Yes,
nurses.
Yeah, there's Dr. Martello.
Right.
And he just brought on Dr. Kearns. So
yeah, exactly.
We need a lot more.
Yeah.
There's a Dance for PD group. I think she's out of Wilmington, Marion. Are you familiar with her?
No.
All right, let me see if I can find it and I'll send it to you. But she's in Wilmington, so she might be a good source. Maybe she can send your program on to her dance group.
Yeah, that'd be great. Thank you.
Asked about the different fundraisers. Karen, if you'd like to talk about your fundraiser, what's cool is that she does it in a local store. So people, again, you get to see what Parkinson's is. Yes, there's funds being raised, but you get to see it. And Barb also talked about that her school district has pay $5 to wear jeans, and that goes to Parkinson's. And sometimes it's just nice to let people know, hey, by the way, this is what Parkinson's looks like. Karen, can you talk a little bit about what you did?
I just had my first fundraiser a few weeks ago. We called it Sip and Shop for Parkinson, to raise awareness and to raise funds for PMD Alliance. It was at a local clothing store, and I was there pretty much the whole day, greeting people, explaining to them what Parkinson was, what PMD Alliance has. Some people came in because I put it on a Facebook group, sent out emails. Some people just walked in looking to purchase clothes. And interestingly enough, quite a number of people said, oh, I thought it's an old person's disease because my aunt, because this one has it. And so I was living proof that it is not an old person's disease and young people can get it too. And we raised, I thought, a nice amount of money. The clothing store is willing to do a national or even a tri-state fundraiser with them. So Eden, if anybody is interested, I'm happy to bring it more regional, more nationally. The next one is going to be at a restaurant, and the third one will be at a liquor store. I thought that was appropriate, but the clothing store was lovely. They brought in Prosecco, they brought in cheese and crackers, banana bread, and they made it a real community event. So it was really special.
You want to talk a little bit about what you've been doing, because you've been doing a lot of stuff?
Sorry, who was that addressed to?
Barb Skuka. She's planning on our group to hand out free water bottles at fests and parades with Parkinson's disease information. So she's doing a lot in her group if she wants to. There you are.
Yes, we let's see. We just had a neurologist come to our group last week, and we ended up with 150 people there. So that was exciting.
Wow.
We learned a lot about the disease and just awareness. And we haven't done the water bottles yet, but I was at a bike race in over the summer, and there was a church handing out water. I'm like, that's a great idea. It's cheap, it's easy. Could possibly get like the sleeves that go over a water bottle, or else even just a business card with it or something to just raise awareness.
Where do you live?
Wisconsin.
150 people. That's,
yeah. And like I just wrote in there too, get to know the press. You know,
Yeah.
a lot of times they want to do like human interest stories and stuff, and our local press is really good to us. So.
Coworkers are also very enterprising. Clemmy is saying that her group will go to local community events like community yard sales and crafts fairs to raise awareness. And Calissa is saying that they made stickers with Parkinson's facts and put them on a local coffee shop, the sleeves in the coffee shop, which I thought is pretty cool. And Roger says he presents at nursing homes, retirement centers, university grad level, with OT, PT, and speech, and just to educate them. Art therapy is also important to get involved in. So again, we're just really trying to get some advocacy out for Parkinson's.
Do you guys think that there's like the interest or scope for awareness, not just locally, but globally as well? And obviously, like, yeah, I don't know. Do you know what I mean? Like it's people sometimes are more interested in the awareness of their communities in their state or country. I just wondered what the interest is in kind of the global reach for Parkinson's disease.
I think your film is helping it. That will be great for it. No, seriously.
Great.
Yeah, I look forward to sharing it.
Thank you very much.
I could probably share it when somehow I could do it at a meeting, couldn't I? They can, they could put that in the computer, not me.
Yeah, you can do somebody can do a screening. At
your no, that's a really great idea. I've got a meeting tomorrow. Send that information out quick.
You got to find someone who can help you do it before tomorrow.
Well, yeah, I've got someone there. I do the other parts. Someone else does.
Sure. Well, you have the link and everything to the film, so use it.
Okay, where is it so I can?
I think that most people, while the initial priority is I want to make sure I have things around me locally, but obviously I do care globally. I mean, nobody can watch this movie and not feel touched by it and not have a visceral reaction that, you know, somebody was basically told, well, you have demons or it's an evil spirit. And it's Parkinson's is not a character flaw or something like that. It's just some dopamine.
And I guess you might be interested in the global situation of Parkinson's, but not really know what is going on or how to get involved. So yeah, please do share it, and this
Yeah.
is your gateway to the rest of the world.
How long was it?
Less than 14 minutes, so just under 14 minutes.
14 minutes. Okay.
Oh, yeah, I honestly think that the people with Parkinson's are going to be more interested in the global perspective, because the general public does not understand Parkinson's, but people with Parkinson's, if you hear that like they can't even get carbidopa levodopa, my life would be miserable without those little yellow pills. So I feel like we actually as a group probably have more interest in that global perspective on it, because, you know, it's bad enough here, but, you know, without medication or being stigmatized like that and being an outcast is going to be so much worse.
Right, right.
Yeah, it's just having that empathy, isn't it? And being able to feel like, what would your life be like if you were born there, if you happen to live there instead.
And their families are probably stigmatized as well.
Yeah, you both, they're stigmatized and stigmatized in different situations. So
yeah.
Oh, Roger made your eyes leak. That's good. Oh, good. Wonderful. Now, if anyone's on Twitter as well, feel free to share the links on Twitter. I'll put my my @ what's my, no, sorry, not Twitter, X. On Twitter. David, what's yours? David A. Plummer.
I think so, yes. Yeah.
And David obviously posts some wonderful things about his work and photography and all the exciting projects he's been involved with. What's your recent one?
I was on BBC One with on a documentary about birds of prey on primetime TV, and I've got a film at the London Film Festival this week, actually.
Wow.
About rewilding.
Very
So
cool.
that's being screened on Friday. So yeah, I don't often talk about Parkinson's through my work, but it's a sort of add-on. I like showing my work, and by the way, I also have Parkinson's, and I think it's a good way of communicating things, because I think it shocks people that way. Oh, I've lost audio again.
No, I've got you.
No, you're okay.
Sorry, I just had to move to plug my laptop in. It's getting tired.
Any other final questions or thoughts for anyone?
I was just also going to say thank you to PMD Alliance. It's very, very kind of you to have us here and to enable us to share this. So yeah, thank you very much. And Clemmy as well for joining on your holidays and for all your support with the Global Support Group Guide as well.
Yes, thank you.
Thank you both for what you're doing.
We're the grateful ones that you shared with us. And David, that was raw that you did shoot off your meds to kind of show like this is what it's like. And, you know, as Lauren said, I'm aware that I can't imagine if there was no carbidopa levodopa that, you know, that you did this to kind of show that empathy off meds, you know, so that you were going through what they were going through.
Yeah, I didn't want to appear like a rich person turning up in a village in Kenya with the same thing they had, but with it partially managed. I wanted to show that I was exactly the same as them, just different continents, different upbringings, but exactly the same disease. And I think the connection with them was all the more close and all the more poignant because of that.
Yeah, they were just so happy to see you, weren't they? And just to finally meet somebody who had the same thing as them. It almost legitimizes that that diagnosis and that experience. So yeah, thank you, David, as well for putting yourself in that situation.
No problem. It was hard though.
Yeah, it was tough. We
Did it
pushed
take
on
you
for
long?
a week. Oh, was
Yeah.
it a week, David?
10 days from that, I think, in total,
Yeah.
from landing to me. You stayed another couple of days, didn't you?
Mm.
But I had to go and film leopards.
Yeah, no, it was about 10 days, so it was really intense. Intense filming. We all kind of hit a wall, didn't we? David particularly with being off meds, but we all definitely hit an emotional, physical wall after this constant kind of stories about how horrible life was, basically, and feeling a bit helpless.
But you're helping.
Hope
How
so.
many people are in the support group that you organize? Because I do think usually the joy of a support group is that when you walk into that room, everybody understands where you're coming from.
Mhm.
And I just think that was clearly, again, there wasn't that understanding that makes it all the more harder. So I love that you started a support group. How many people are in it, or
Yeah,
is it growing?
so we have a WhatsApp group for it as well, and there's about 50 people in it. So that's people with Parkinson's, caregivers, family members. And at the meetings, we have monthly meetings, and there's probably like 10 to 20 people at every meeting, and it's usually more caregivers or family members, just because for some people it's really difficult to get to the meetings, especially when they live in more rural areas and public transport is not very existent. And obviously they don't have cars, and they can't really get public transport sometimes because it's just difficult to maneuver when they're kind of advanced stages of Parkinson's. So yeah, it's a different kind of, like Clemmy and I were discussing this when we were doing the support group guide, it's a different dynamic in which a lot of people come to the meetings to learn about Parkinson's because it's the only place they kind of can. So the caregiver will come learn about, how to turn somebody in beds and kind of go home and practice that, or like act it. So it's a very different kind of dynamic of support group to ones you might have in the US as well, because it's the only place they can get that information and tips and things, or like learn about diet, or the fact that you shouldn't have protein 30-40 minutes before or after eating, just basic things like that just are so beneficial to someone's life. Yeah, so yeah.
Wow.
Thank you
What
so
percentage
much.
see doctors?
They all will have seen a doctor to get a diagnosis, so that's a given. So they'll have seen a neurologist eventually, not necessarily within 5-10 years of starting off with symptoms, but they usually see them once at least to get a diagnosis, and then who knows from then. But anyone who accesses a support group or has access to levodopa, carbidopa has at some point managed to get to see a neurologist, and that is a minority. So you can imagine the people that are living without that. It's just crazy. Yeah.
Is Cinemet reasonable in price there?
No.
Yeah, Cinemet not. So generics are more affordable,
Okay.
but still not affordable for us. It might be affordable, but it's contextual, isn't it? So for the people and what they earn, it's just not affordable at all. And it often out of stock as well. So you might just go a few months without it being anywhere for you to buy, even if you had the money to buy it. So yeah, there's a lot of challenges relating to medication.
Wow.
Yeah. But lots being done as well.
Both for being here today. We're so
Yeah.
grateful. We really appreciate your time. And I hope everybody has a wonderful rest of the day. But I'm so grateful everybody joined us today. And I hope you have a great rest of your week. Bye, everyone.
Bye.
Thank you so much, Eden.
Thank you.
Thank you.
Thank you.
Thank you.
Bye-bye.
Bye.